Okay, let's start. Hello, everyone. Good evening for all of you. Let's start our revision, the fourth free revision. Seconds. Okay, let's start. Today we will have the fourth free revision. As usual, we will discuss about 20 questions from previous exams. We will discuss the concept, and if we have other question like the question that we discuss or we will explain it. Okay, and at the end, I'll open the discussion as usual for all of you to ask about what you want. The first question today here for verapamil metabolism. It should be considered while taking which drug? Which drug may affect the metabolism of verapamil? Firstly, verapamil is metabolized by which cytochrome? It is cytochrome 3A4.
3A4.
Yes, it's like the delta Z. Both are metabolized by this cytochrome. So the cytochrome system may affect the metabolism of this verapamil. Either the inducers or inhibitors to the cytochrome 3A4 will affect the verapamil level in the blood. Let us see the choices: aprepitant, erbizostan, carbamazepine, and ipratropium. Carbamazepine is a common inducer, so it is the first drug that you should think about regarding to those choices. Okay, what will happen to verapamil in this case? Carbamazepine is an inducer, so making or causing an induction for the enzyme cytochrome 3A4 and increase its activity, leading to decrease level of verapamil. Or what else? Decrease its T-half. So if you have any of the following expressions, all of them are right. Decreasing the level of verapamil, decreasing the T-half, while increasing what? Increasing its metabolism and increasing its clearance. Okay, so you should know the four statements so that whatever the statement that you face in the exam, you can answer it very easily. Let's see the second question. Glycoside linkage or glycosidic linkage in cardiac glycoside is ether or ester or amide or disulfide. Generally, the glycosidic linkage will be between sugar part and alkyl part. So here it will connect carbon to oxygen to carbon. What is the functional group containing this connection? It is ether. So any glycoside is an ether, but not all ethers are glycosides. It should contain sugar part to consider as an glycoside. In the cardiac glycoside especially the digoxin, what we have? We have three sugar parts connected to oxygen. This is the glycosidic linkage. This oxygen connected to steroidal ring. What about the cardiac activity?
Lactone ring on
Yes.
17 carbon.
Lactone ring in carbon Number 17 is the ring that giving the activity of the digoxin or any cardiac glycoside. Which of the following causes a decrease in renal calcium clearance? Decrease in renal calcium clearance. Take care about each word in the question. Or impairs calcium excretion. What does this mean? Decrease renal calcium clearance. Means that increasing reabsorption of calcium. So we are looking for the drug or the substance that increase the reabsorption of calcium, which may lead to hypercalcemia. The hypoparathyroidism, it's not effective. Treatment with chlorothiazide. Thiazide diuretics increase the reabsorption of calcium. So this is the right answer here. Okay, while furosemide increase calcium excretion. So it is a wrong statement. And extracellular fluids volume expansion, also not increasing calcium reabsorption. What happened after exercise? Which of the following statement is true? After exercise, the systolic and diastolic pressure remains stable, or systolic increase while diastolic remains stable, or diastolic increase while systolic remains stable, or the systolic and diastolic increase. After exercise, the systolic will increase while diastolic remains stable. This is the right answer of this one. Which of the following is not a serotonin reuptake inhibitor? All of us know in this group helping in reuptake of serotonin inhibition, so that increasing the serotonin in the brain and treating the depression. This group contain or have some drugs like citalopram, escitalopram, sertraline, paroxetine, fluoxetine, while trazodone is not one of the SSRIs. Another question related to the SSRI, which antidepressant is most sedating? Not SSRI, as generally as antidepressant drug. Which is most sedating? Fluoxetine, duloxetine, nortriptyline, or citalopram. We have some groups are called activating
And deactivating, yes.
and some groups called sedating. Okay. The activating groups, we have bupropion, we have SSRIs except two of them, except paroxetine and fluvoxamine. They are sedating. So paroxetine and fluvoxamine, they are sedating, while others are activating. And the third group is SNRIs, all of them. Venlafaxine, desvenlafaxine, milnacipram, all of them are activating group, while others are sedating group. The most sedating, we have many drugs causing sedation with a high effect, like trazodone, but trazodone is not present here. Here we have fluoxetine, one of the SSRI that is activating, not sedating. Duloxetine, SNRI, that is activating. Citalopram, SSRI, that is activating. While nortriptyline, one of the tricyclic antidepressants, which have antihistaminic side effects leading to sedation effect. What is the expression of apoptosis? This word means a programmed cell death. It is important in our body. It will control the removal of the dead cells if it is not present or not working, the dead cells will remain in our body, which may lead to cancer. Okay, because it will be a core for cancer. Cancer cells will generate over it. So apoptosis is a very important system in our body to remove the dead cells from the body. Let us see this calculation problem. If the rate of infusion of drug is 750 milligram every 6 hours. So we have R equal 750 milligrams every 6 hours. And the clearance rate is 8.3 liter per hour. What is the steady state concentration? As usual, the first step in pharmacokinetic calculation is to know the formula. What is the formula in this case? CSS, simply, CSS equal R over the total clearance. Okay, R over the total clearance. So, can we divide 750 over 8.3 directly? It's not applicable. Why? Because the units are different. We should check the units. All the units should be similar. All the units should be with the same units. Here we have the units of weight by milligram or gram, mostly by milligram. So let us take it as milligram. There is no problem here. The unit of the volume by liter. So here is liter. So there is no problem. The unit of time, here we have a difference. Here 6 hours, while here is hour. So we should convert this 750 milligram per 6 hour into how many milligrams per hour? 750 milligrams every 6 hours. So per hour, how many milligrams? Divide by 6, it would be about 125 milligrams. So directly divide 125 over 8.3 to get the right answer. Okay? So pharmacokinetic problems are very easy, but just know the formula very well and adjust the units. Let us see this one. All the following are appropriate for initiating therapy for Parkinson's disease, except. Let us revise the treatment for Parkinson's. How can we control Parkinson's? Either by drugs affecting dopamine or drugs affecting acetylcholine, or sometimes both. Drugs affecting dopamine, either dopamine precursor, like levodopa, or dopamine agonist, like bromocriptine, cabergoline, pramipexole, apomorphine. All of them are dopamine agonists. Or acetylcholine. What is the type of pharmacological action here? We need agonist or antagonist to the
anticholinergic.
Yes, anticholinergics drug. Anticholinergics. Okay. So those are the treatment. Plus, we can use amantadine. Amantadine is a drug that having effect on cholinergic receptors, having effect on dopamine receptors. Okay. So will be a good drug or good choice for Parkinson's. Even it is not the first line, but we can depend on it. So here we have amantadine. It is used. Entacapone, is it a drug for Parkinson's or not?
No, it is used as an adjunct radiculomyotransferase.
No, it is not for Parkinson's. If we use it alone, it is like when we use carbidopa alone. Carbidopa alone is not for Parkinson's. We use this drug as an adjunctive therapy in order to enhance the activity of levodopa. Entacapone is catechol or methyltransferase inhibitor. So what is the role of it? Catechol or methyltransferase enzyme is one of the enzymes that destroy levodopa in the brain. Okay, and prevent its conversion to dopamine. So it is one of the pathways of the levodopa in the brain, but we don't need this pathway. So that we need a drug that inhibits this enzyme so that levodopa go directly to dopamine without going to the pathway of other metabolites. It's like MAO inhibitor, selegiline. Selegiline also, it's not a drug for Parkinson's. Selegiline is a MAO inhibitor that inhibits the conversion of levodopa to another metabolites other than dopamine. Okay, so we cannot consider entacapone as a drug for treatment of Parkinson. Therefore, this is the right answer. While carbidopa, levodopa, here the combination is used. This is the first line. Pramipexole also one of the dopamine agonists. Okay? Let us
Yes,
see
sir.
this. Yes, please. Okay, let us see the calculation problem, the coming one. A patient weighing 90 kilograms body weight with normal renal function is injected with an intravenous drug for 10 hours. The desired plasma concentration is 22 milligram per deciliter. Okay. The T half of the drug is 1 hour. And the apparent volume of distribution is 9 liters. What is the rate of infusion? Let's see what we have and then see the formula. We have the CSS, which be 22 milligram per deciliter. T half equal 1 hour. So that directly the K equal 0.693 hour minus 1. Okay. The volume of distribution equal 9 liters. We need to calculate the R, rate of infusion. By which unit? Here, milligram per hour. Okay. The first step is knowing the formula. What is the formula? Here we have a formula saying that R equals CSS multiplied by VD multiplied by K. Okay, so just multiply all of them together. But before multiplying, we should adjust the units. The unit of the weight, milligram here, so there is no problem. The unit of the volume, deciliter. So here, for volume, we should convert it into deciliter. It would be 90 deciliter. Okay. The unit of the time is hour, so there is no problem. Directly multiply 22 by 90 by 0.693, you will get the answer, which will be 1,372.14 milligram per hour. Okay? Ethylene glycol, it's one of the toxins if administered or ingested to the blood. It is antifreeze, which oxidizes to toxic metabolites. The toxicity of ethylene glycol related to which compound?
Oxalic.
Yes, oxalic acid. Simply, if you don't know, draw the ethylene glycol. What is the ethylene glycol structure? C
H2O.
H2 C H2 OH and OH. It is by alcohol. Okay. The alcohol is primary here, primary alcohol. Both OH group are primary. So the first step of oxidation, what is the result? Aldehyde,
Right.
aldehydic group. Still, we have H. So another oxidation step. What is the result? COH and COOH. What we call this structure, it is oxalic acid. Okay? So the resultant acid from oxidation of ethylene glycol is oxalic acid, which leads to the toxicity of the ethylene glycol. What is the antidote for this oxide?
Formipizole
Formipizole. Formipizole.
and ethanol injection.
If formipizole is not present, ethanol injection should be given. Okay. Plus, which drug will utilize oxalic acid? Which substance will utilize oxalic acid and decrease its toxicity?
Thiamine and
Pyridoxine.
pyridox.
So the patient here should take thiamine and pyridoxine to utilize oxalic acid and decrease its toxicity. While
How
formipizole,
how they will neutralize it? Can you just explain about thiamine?
here the thiamine and pyridoxine will consume the oxalic acid that's present in the blood.
All right.
Okay. Okay. While formipizole is the drug that prevent oxidation of ethylene glycol. So it will prevent the formation of oxalic acid from the first step. Okay. And if formipizole is not present, ethanol is instead of that. What is the role of ethanol in this case?
It
Ethanol,
competes for alcohol dehydrogenation.
yes, ethanol will compete with ethylene glycol to the same enzyme, so that decreasing the possibility of metabolism of ethylene glycol, and the resultant oxalic acid amount will be decreased. Okay, this is the role of ethanol in this case.
Is this thiamine and pyridoxine used for all kind of like
No,
alcohol and
not
acid?
for
Only for this? Right.
not for all alcohol toxicity. For
For
example,
methanol, it is folic.
methanol. Methanol, what is the vitamin that can help in utilizing the formic acid that formed of methanol? Here we have folic acid. Okay, we need folic acid to do the same action that thiamine and pyridoxine do for oxalic acid. Here we have acid. Okay.
Yeah, thank you.
Okay. Which of the following is most common metabolizing enzyme for clopidogrel? Clopidogrel, as you know, it is a prodrug. So it should convert it to its active metabolite in order to give the effect through the metabolism by the enzyme cytochrome 2C19. Which of those is the structure of propylene glycol? We just draw the ethylene glycol, CH2OH and CH2OH. Propylene glycol, just add one CH3 here. So it is the propylene glycol. So this is the ethylene glycol. This is metabolism. This ethanol. While this is the propylene glycol. A patient have a 35 years old female with diabetes. Currently, she has been diagnosed with urinary tract infection. Which of the following anti-diabetic drug interact with cotrimoxazole? Cotrimoxazole, as you know, it is a combination between trimethoprim and sulfamethoxazole. Okay, so what is the answer here? Metformin, rosiglitazone, glipizide, or canagliflozin? Here, the anti-diabetic drugs that interact with cotrimoxazole is glipizide. Cotrimoxazole can increase the effect of glipizide, leading to a higher risk of hypoglycemia. Here, we are fearing from hypoglycemia that may happen. And it is important to monitor blood sugar level closely. Okay, and adjust the dosage of glipizide as necessary when co-administration with cotrimoxazole. Which of the following is not used as a vehicle for injection? This question repeated many times previously. Let us see the choices and then you will answer. Peanut oil, cottonseed, corn oil, or theobromine oil. Which one do you expect?
D.
D. Yes, it is
And
theobromine oil.
suppositories.
Why? Theobromine oil is the other name of the cocoa butter. Okay, so cocoa butter is solid at room temperature and melt in the body. So here, it's not applicable to use a solid in preparation of injection. Okay, therefore, theobromine oil not used, while others can be used as a vehicle for injection.
Sir, one question
Mhm.
related to cocoa butter. This is mostly done by a compression method or by fusion method or by hand rolling method in making suppositories. Can you please answer?
For making these suppositories, it is the base that melt in the body temperature. So if you use it for preparation or synthesis of the suppository using cocoa butter, using fusion method. Hyperventilation is a condition that leads to hyperventilation. What happened in hyperventilation? Increase in the breathing rate, leading to increase exhalation of carbon dioxide. What does this mean? It means that the level of carbon dioxide in the blood decreased. So what? What about pH of the blood? Upon decreasing the carbon dioxide level in the blood, pH will increase. The blood becomes more alkaline, more basic. Okay, so we have here a case of respiratory alkalosis. A lower in carbon dioxide concentration, followed by a rise in the pH. Okay, this is what happened when there is hyperventilation. The answer is A, not C. By lowering carbon dioxide, the pH will not decrease. It will, I'm sorry, will not, yes, will not decrease. It will increase. So this is a wrong part. What is the intravenous bolus? We have intravenous administration, either bolus or infusion. The bolus here means a rapid injection of medication directly into the bloodstream through the intravenous axis. The first one is the intravenous infusion. Quaternary nitrogen is present in which drug of the following containing quaternary nitrogen? Tropicamide, ipratropium, pyrenzepine, dicyclomine. It is ipratropium. What is the quaternary nitrogen? This nitrogen connected with 4 bonds, so it will carry a positive charge. It is polar. So taking the drug cannot pass the blood-brain barrier, firstly, have a short acting effect because it will be eliminated very easily. Ipratropium is one of the drugs containing quaternary nitrogen. Can you give me another example of drug containing quaternary nitrogen?
Neostigmine.
Yes, neostigmine. It contains quaternary nitrogen, so that we use it in myasthenia gravis, but we cannot use it in Alzheimer. While other stigmine family, like rivastigmine, it is a tertiary amine, so can pass the blood-brain barrier and can treat the Alzheimer, not like the neostigmine. A patient here, old, 40 years old male, 40 years old male, has recently been diagnosed with major depression and was prescribed a medication, fluoxetine 20 milligram once daily. He asks you to have the optimal response time. What is the optimal response time for his medication? What is your response? Here we are talking about the period of the starting of antidepressant effect for getting the full effect of the antidepressant. It is range in between 4 to 6 weeks. This is the normal range. But here we are talking about the fluoxetine, which have a very long duration range. So its effect start or take a long time to start or to give the full effect, which will be about 6 to 8 weeks. So this is the right answer here, 6 to 8 weeks. Let us see the last question today. At what dose dopamine function as a positive inotropic effect? Dopamine can be used therapeutically with 3 different doses. The lower dose, the intermediate, and the high dose. The lower dose below 5 microgram per kg per minute. Intermediate in between 5 to 10 microgram per kg per minute. Higher dose over 10 microgram per kg per minute. Okay. The lower dose here, what is the pharmacological action of it? It will increase the blood flow to the kidney.
Blood, yeah.
So it will lead to diuresis or may give an effect of diuresis. While intermediate dose, it will increase the cardiac output, increase the contractility of the heart. So it has the positive inotropic effect through this dose, the middle dose in between 5 to 10. While the higher dose, it causes vasoconstriction. The higher dose will cause vasoconstriction, so it is not applicable for the congestive heart failure if the patient will use dopamine. You should not use the higher dose of dopamine over 10 microgram per kg per minute. This was the last question today. But still, we have another revision in the coming Sunday. Okay, so I hope we will attend the coming one, which will be the last one. Still, we have the full revision. You can join it from this link. Okay, this contains the full revision, the full 4 lectures. In this revision, we discussed many of the questions from the last exam, especially the last one. Also, it contains the mock test. Mock test present also in this package. Okay,
Sir?
so you can join this revision till the exam is still available, and you can join it at any time you want. Yes, we
Sir,
can
sorry,
open. Mhm.
sir, there's a question, please.
Yes, please. Okay.
Sir, if we can...
I'm not hearing you. Your voice is breaking.
Sir, I also want to repeat question number 16, I think, about hyperventilation and respiratory alkalosis.
Okay. Let us
Please.
repeat question number 8 firstly. Then we will go to the question
Okay.
number 16. Here in question number 8. Here we have the rate of infusion, which is 750 milligram per hour every 6 hours. Okay. And we have the total clearance, which is 8.3 liter per hour. What is the CSS? Here we have a formula collecting those information together and help us to calculate the CSS directly. But we cannot divide R over CL or the total clearance directly here from those information because we have different units. We should make the units adjusted firstly, then we can solve the problem. How can we do that? Here, 750 milligrams every 6 hours means that every 1 hour, how many milligrams injected? So just divide 750 over 6 to get how many milligrams injected per hour. Then we can divide this number over the total clearance to get the CSS. Okay, I didn't calculate it, so it may be 15.06 gram. Why gram? Why gram? Here we are using milligram, not grams, so that the answer for sure will not be this one. Okay, it will not be gram per liter.
Sir, I still have a confusion whenever this respiratory acidosis or alkalosis.
Okay, I'll go to this
This is
question.
really
I told you that I'll go to this question. Okay. Question number 16. Let's go to it. Here, what happened in a hyperventilation? Hyperventilation means what? Increasing of breathing rate. Imagine that you have a fast breathing rate or a rapid breathing. What happened in this breathing? The carbon dioxide will be exhaled in a high level. So its level in the blood will decrease. Now we have low carbon dioxide than normal. Low carbon dioxide than normal. So what about the pH? Low carbon dioxide is the acidic one. When it is decreased, the pH will increase. Okay, is it clear now, or still you have a confusion about anything?
Yes, sir, it is clear. And but sometimes we say that whenever there is metabolic acidosis, the compensation is by hyperventilation. It means that we are moving carbon dioxide out.
Here, we didn't mention anything about the metabolic acidosis. what happened firstly? Is it metabolic acidosis or hyperventilation happened?
This is
Looking for,
hyperventilation.
yes, looking for which happened firstly. If the effect firstly happened in the lung, so we are talking about the respiratory, no relation with metabolic at all. But
Okay.
if we are talking about the kidney or the blood, then it is metabolic. And the compensation will be from the lung. The lung will do the opposite thing to correct the case.
Okay. Right.
Okay. Still, we have another one, as I mentioned. Also, the full revision present, plus the mock test. You can either join the full revision, which include the mock test, or join the mock test alone if you want. Okay.
Sir,
Yes. Just tell
sir,
me one
actually, we
second.
sorry, sir, we have joined your full revision test and a mock test as well. So,
Yes.
sir, if we do all the things,
Mhm.
so do we need to revise LMS or other notes, or is that enough?
They are enough, but if you want to revise more and more, it's not a bad thing. But take care about the questions, because some of
Actually,
them are not full questions, may make some confusion for you. But it's not a bad thing to revise them. If you have a time, revise. You can revise them. You can revise all of them.
actually, sir, about 1.5 months ago, we came to know this exam, and we can only sit in November exam. Because we were on.
Your voice was breaking. I can't hear you.
Sir, do you hear me? No?
No, no, no.
Okay, sir, I'll text you.
Okay.
Thank you so much, sir.
You're welcome. Okay, so do you have any other question? Well, thank you very much about your attendance today. I hope it was useful one, and see you in the last revision in the coming Sunday.
Sir, one thing more I want to ask that sometimes in drug interaction questions they put a dot in between two words. So how are we going to interpret such questions?